I'm joined by Chris Walker, Emergency Coordinator for the Hamilton County Health Department. Good morning, Chris.
Good morning.
Bring us up to date from the weekend. How are we looking?
We're about on track with where we expected to be. We're still accounting for about 5 or 6% of the total cases for the state. Which is online with what we would anticipate. We're not seeing a large spike outside of our percentage based on the state numbers. So I think we're doing okay. Projections are that this week may be the roughest week we have for the duration, but we're prepared for that if that comes about. So
everybody's been touting this study out of the University of Washington. I know last week it was predicting that our peak would be this week, but they've since revised that and they think maybe we hit our peak last week. What do you think? What have you seen?
So we refer to this data as well from the University of Washington. We use it as a tool. It's not the only tool we use to base our decisions on, but they were anticipating that the first half of this week was going to be the roughest or the peak for us. However, they have been trending and pulling that information back some, and it's possible that we saw our peak last week at the end of last week. One of the things that was notable is that they had started out with the initial death count nationwide of 100,000 to 240,000. That's now been pulled back down to the 60,000 range, which is more on line with what we see in a normal flu season for the nation.
That's good news. And I think feeling like maybe we hit our peak is good news too, but I would suspect, do you think maybe we don't take our foot off the accelerator at this point?
That's correct. Just because we've peaked does not mean that we can't change that outcome. If we start rolling back our social distancing and our safeguarding measures now, we could very well see us move back into an acceleration phase. So we've got to continue with the good social distancing and all the measures that we've been taking thus far to protect ourselves and our families.
So we know that the governor's stay-at-home orders are expected to expire April 20th. Would you expect those to be extended again?
I think if we look what's going on across the nation, I think we will probably see them extended at least 2 more weeks to help make sure that we truly have flattened this curve and that we are really starting to trend downwards. I think that would be a prudent action on his part.
And we've also heard of a surge in the number of cases in long-term care facilities throughout the state. How are we doing here in Hamilton County?
Again, we're doing about as well as we expect to do. The long-term cares are dense populations of the most at-risk people, which is very unfortunate, but we've been working very hard to make sure that our long-term cares get the supplies they need to help safeguard their residents and the most vulnerable population we have in the county.
You guys have been doing a heck of a job providing them with some of the equipment and PPE that they need. Tell me about that.
So we've been able to push out about 32,000 surgical masks to our health and medical partners, including fire and EMS. Last week, we were able to also push out 500 surgical masks to each of the police departments within the county. We've additionally pushed out over 4,000 N95 masks to our long-term cares, as well as face shields, gloves, surgical gowns, all the protective equipment that they need to help safeguard those most at risk and to safeguard themselves as well.
And kind of a not so great question, but one I want to throw at you. If I have a loved one in long-term care, maybe I'm worried about their safety or well-being or how how that particular facility is handling the COVID. Who would I address those concerns with? Is that you?
Well, step one is to talk to the facility where they're at. Have a honest conversation about the care that your loved one's receiving, and make sure that they're doing the best they can. A lot of that guidance is pushed out from the federal government through the state down to the long-term cares. And if you still have a concern, the licensing agency for long-term care centers is the State Department of Health, and they do have resources that you can go to file a complaint, to get further guidance, and to ask more general questions and get more assistance from them regarding patient care to long-term care facility.
Good. Any projections for the week ahead? Anything everybody needs to keep in mind as we move forward this week?
Just to make sure that you're still maintaining your good social distancing. I haven't looked at the weather to see how much we want to be outside or not this week, but that social distancing is key. Keeping your trips to essential functions only. You know, we don't need to run to the grocery store every time we run out of something. Let's get some of that lumped together and make one trip. Again, hand washing. If you're sick, stay at home. If you need medical attention, call ahead. Same thing we've been doing for the last few weeks now. So,
Keep it up. We're doing a good job.
all right. Thanks, Tammy. Appreciate it.
All right. Thanks.